Hello, my name is Erica Cornejo, and today I have a slideshow that I would like to share with you covering thrush, otherwise known as oral candidiasis. If you look on the left in this picture, it shows what a normal healthy mouse should look like, and then on the right, this shows a picture or a dramatization of the illness that we will be covering today. As I said, my name's Erica Cornejo. I'm a nursing student at Vincent's University on their Jasper campus. And I'm also a student who is taking microbiology. I've learned a lot about bacteria, viruses, fungi, and what I learned in class really helped me develop this presentation that I would like to share with you today, as well as all of my scholarly sources like the CDC and the Mayo Clinic. And today I would like to teach you how to prevent thrush, what it is, what causes it, and what to do if you happen to get it. So, if you're anything like me, you might have thought that it came from a bacteria. It's not a super uncommon infection. I've heard about it before, but I wasn't sure what caused it. And I thought that maybe you picked it up from interacting with other people. But it turns out, according to dermnuts.org, 50% of the normal flora in the mouth actually consists of the agent that causes thrush, and it's actually good for us and part of our normal healthy flora. And if you don't know what flora is, that's basically a mix of, bacteria or any living microbes in a given area of the body that are actually beneficial. So you could find this agent that causes thrush not only in the mouth, you could find it in the throat, the digestive tract, and actually all the way through to the genital area or the rectum. And it's really caused by a loss of control and an imbalance of the flora that allows for this agent to kind of overgrow. So today we'll be covering what it is, the causative agents, risk factors, signs and symptoms, diagnosis and treatment, as well as prevention. So what is thrush? Thrush is also known as oral candidiasis, so that is the name of the infection. And it's not a bacterial infection, it's a fungal infection of the mouth and throat. So it's not caused by new exposure to new microbes because we already have it. As mentioned before, the CDC does say that it's really caused by an imbalance of our normal flora. So we're not having that natural balance of bacteria and yeast or fungi that we should have. So what is the causative agent? The causative agent is Candida albicans. It is a fungus. It's non-filamentous, so it's not fuzzy like a mold. It is unicellular and it is a yeast. So it's an opportunistic pathogen. So that means if there's somebody who is immunocompromised or something happens to the flora that kind of throws it off, it will take that opportunity to come in and overgrow, and that is what will cause our issues. So who is at risk for it? Really, anybody is susceptible. All ages can get it, but there are some who are more likely to get it than others. So the first is infants, because their immune system is still developing and they don't have a way to fight it off, or at least not as well as some of our more developed ages do. So then with that, we also have the elderly, and their immune system is weakened as they age. That just happens naturally. It's harder to fight things off when you get older. And they also produce less saliva. So with less saliva, this causes dry mouth. And with dry mouth, that causes a loss of our ability to wash away unwanted germs and microorganisms, as well as there are proteins that are present in saliva that help us keep our normal flora balanced. And whenever we are not having or producing that saliva, we lose that ability and we lose those good proteins in there. Another thing would be antibiotic use, because if you're killing off all the good bacteria, then you're allowing more space and opportunity for the yeast or the Candida albicans to come in and overgrow. Along with that, our diabetics are at risk because they may have high blood sugar if not managed well. And if you have high blood sugar, that allows for sugar to be kind of in all areas of the body, and the body is not sure how to manage it. So this allows for that yeast to feed off of that sugar and flourish. So signs and symptoms, if you look at the top right, you could see that there are white patches in this person's mouth, and that is like a very classic universal symptom of thrush. And if you scrape it, if you look in the bottom right, you see that red tender area, and that's what happens when you take off those white patches. There's red tissue, and it's very sore, very painful. Many people say they have burning sensations in their mouth, a loss of taste, and they may get cracking at the corners of the mouth, as we could see in the elderly gentleman there. Diagnosis and treatment. Diagnosis consists of physical examination to look for those white patches. We can look at medical history. So as we mentioned, the immunocompromised or diabetics, we can look at those to kind of see if maybe thrush is something we should consider and they may be more likely to get it. We can also look at medications because, as we mentioned, antibiotics and using too many or just using them in general can throw off our flora, even when necessary. So we could look at that for clues as well. And testing, while not usually necessary, it consists of maybe taking scrapes of those white spots, as well as looking for antibodies in the blood. And then treatment, many people would say, well, we need an antibiotic, but we actually don't want to use an antibiotic because it's not a bacteria, it's a fungal infection. So that's important because if we know that it's caused by a fungus, we can use a medication that actually targets fungus and not bacteria that we want to keep. So the good news is it's usually a mild infection and it's very easy to treat. So some common medications would be nystatin, and this causes damage to the cell membrane and it causes all the contents to leak out and it kills it. And then we could also use fluconazole, and there is a lipid in the cell membrane called ergosterol, and fluconazole causes damage to that lipid and therefore it damages the cell membrane and kills them off that way as well. And treatment lasts 7 to 14 days, so it usually goes away pretty easily. Prevention, according to the CDC, is really dependent on good oral hygiene. That's the strongest preventative measure that we could take. And a quote I have is, good oral health prevents candidiasis in the mouth, throat, and esophagus, which is pretty straightforward. So good oral hygiene is really important. So brush twice daily and floss, as well as managing any diabetes or any medical conditions that might allow for the yeast to flourish or make us more at high risk. And we want to avoid unnecessary use of medications like antibiotics. So, conclusion, what did we learn today? I hope that you learned that it is caused by a fungus. It is a fungal infection of the mouth and throat. The fungus that causes it is Candida albicans, and it is actually normal in small amounts, and the imbalance is what causes issues. It's typically mild. We can prevent it by good hygiene and good medical practice. And one thing I really took away from this is that it's not always new microbes that are causing issues. And sometimes we just need to take care of the good bacteria and good microbes that we already have to prevent these things from happening. And I just want to know, what did you learn today? And I hope that with this information, you can take it and that you know how to prevent thrush and you know what to do if you happen to get it, and that you have some peace of mind in knowing that it's typically pretty mild and easy to treat and not really something that we should worry about or have fear for. So thank you for joining me and thank you for paying attention. And I was so happy to share this presentation with you. Thank you very much.